When it comes to healthcare in Canada, it can be difficult for women to find treatment or advice that is tailored to their needs. But a group of women from the University of Toronto are hoping to help change that. They've created an online platform aimed at empowering women to advocate for their own healthcare.
We are WEMS.
It's called Women's Health Education Made Simple, or WEMS. Through their website and social media accounts, a team of healthcare providers and medical students have created a space where women can find accurate and reliable information on topics like pregnancy loss, mental health, and menstrual health.
We're trying to make things more easily accessible, more easy to understand, and empower women to know, okay, you know what? Me having a period for a month is actually not normal.
The platform is a way for the team to address the long-standing gender disparity within Canada's healthcare system. Studies have shown that health concerns affecting women are often ignored or not tailored to meet their needs.
One of the things for women is that, there's always the stigma, especially around pregnancy loss, whereby there isn't enough resources to help women combat some of the stigma they go through.
We also know that heart disease kills more women than men, and yet women are 7 times more likely to be misdiagnosed.
The problem is so profound and it's so common that, you always wonder, why has this not been addressed?
They say the pandemic has made the issue worse. Now, patients have only limited contact with their healthcare providers through brief and mostly virtual appointments. Not an ideal environment to speak openly about topics that some women may be too shy to bring up. All 3 founders of WEMS are BIPOC women, something Dr. Bazrin says was an important aspect of the initiative.
If you look at our logo even, our logo represents diversity, which is reflected in our exec team. It's all about having, debunking myths, getting rid of stigma, talking about things that a lot of people who look like us don't like talking about it.
Since late last year, the group has made more than 20 videos, multiple infographics, and garnered thousands of followers. They've also provided a feedback portal where anyone with additional questions or ideas for future health topics can reach out. With International Women's Day just days away, 4th-year U of T medical student and co-founder Salwa Faruqi says she's learned a lot by starting this movement and has this message for other women.
I would encourage all women to start their own projects, start their own initiatives, and to look for things that they can sort of advocate for and be passionate about as well in their own spaces.
WEMS has received funding through a U of T scholarship as well as the North York General Hospital Health Innovation Fund. For a link to their website, head to citynews.ca/extras. For City News, I'm Erica Natividad.